I'm the Student Health Promotions Manager here at UW-Stout. I'm excited to give you some information about health while you're traveling abroad. The most important thing that we're going to talk about today is getting a pre-travel physical prior to traveling. It doesn't matter if you're traveling short-term for a semester or an entire year, we recommend that you see a provider 4 to 8 weeks before travel. There's no charge for getting your pre-travel physical at Student Health Services here at Stout, and it's a great way to talk to the provider about a wide variety of topics. The first thing that you might talk to the provider about is vaccines. There are routine vaccines, including tetanus vaccine every 10 years, measles, hepatitis B, varicella, which are standard childhood vaccines you've likely already had. And then there are seasonal vaccines such as influenza, and COVID vaccine will likely become a seasonal vaccine also. When you are thinking about a seasonal vaccine, remember that the Southern Hemisphere, their flu season, their influenza season is in the summer, not in the winter. You should check when you last received your influenza vaccine and vaccinate appropriately. Other specific travel vaccines include hepatitis A vaccine, which is a 2-shot series. The first dose is typically done before travel, and the second 6 months later to receive a full effect. The typhoid vaccine is recommended if you're traveling to island nations, South America, Asia, or Africa. This is an oral prescription, and you would be wanting to take that prior to your travel. Other vaccines that may be considered necessary for the countries you're traveling to include meningitis B, rabies, yellow fever, and Japanese encephalitis. You may visit the Walgreens pharmacy in Menominee for many of these vaccines. They offer a tab for travel health services on their website. Another way to obtain the vaccines is to visit a travel clinic. There is a very robust travel clinic associated with the airport in St. Paul, Minneapolis. If you don't choose to have a pre-travel physical, you can look up which vaccines are recommended for the country that you're traveling to at cdc.gov. They have a great travel website. You enter the country you're traveling to and then look up what vaccines are recommended for that location. This website also has travel alerts for activities that are happening in a specific country, such as a communicable disease outbreak. In some South American countries, island countries, Asian and African countries, malaria is very prevalent. Malaria is a disease that's transmitted from an infected mosquito. You may want to bring bug repellent with you or buy it in country, and you may want to use netting when you're sleeping. Just be aware of the recommendations in your area, which you can find on the CDC website we mentioned earlier. There is a medication that you can take before you travel and throughout the time you're traveling and for a short period when you return to the US that can prevent malaria. You may also want to discuss traveler's diarrhea with your physician. It's a very real thing that happens, and you're going to want to think about your food choices when you're traveling. It is recommended to use bottled water. If you don't have access to bottled water, boiling it is important. Be sure you're eating well-cooked food or eat things that have a rind that you can peel so that you know the inner part has been protected. Don't eat or drink something if you're unsure of how it was prepared or if you're not sure of the water supply. There are both over-the-counter medications and prescription antibiotics that can be given prior to travel so that you would have with you should diarrhea happen. If you plan to take prescription medications abroad, there are several considerations you would need to plan for in advance, such as bringing enough medication with you for the duration of the program, or making arrangements in country to fill or renew medications, and receiving receiving permission to have certain medications in the country. It is the responsibility of the student to check on entry requirements for the specific country that you are going to. And this is particularly for controlled drugs such as ADD medications. In some countries, the medication and quantity that you can carry are restricted. Permission from the foreign government may be needed, sometimes 4 to 6 weeks in advance. Your provider can help you determine if your medication is legal, available, and accessible abroad. Discuss these travel plans with your physician to inquire about a supply of medication for the duration of your program. For any medications, it's a good idea to request a copy of the prescription and carry a letter with you from your healthcare provider. Consider how you will need to store and transport your medications. For severe allergies, carry a medical card with the name of those allergies translated in the local language. For more information, you can look on that CDC website we've mentioned and look under the tab Travel Abroad with Medicine. We did mention earlier about COVID vaccine being very important for travel. As far as COVID testing, most countries, including the US, no longer require COVID testing for entry. However, your overseas university may have different requirements, so you'll want to review their specific information and instructions carefully. We do encourage students to travel with COVID antigen home tests in case COVID testing is difficult to find in your country of destination. It's also just convenient to have your own test. If you're having symptoms while you're traveling, you can take the test right away and know if it's COVID or something else. Should you test positive while you're traveling, you may refer to the CDC website for guidance on COVID protocols for the country that you are traveling in. The next topic is sexual health. We really encourage students to be prepared for any sexual health needs they may have while traveling. For example, it's important to have a birth control plan. If you're going to be gone for a semester, you might want to think about the birth control you're using and how available it will be in the country. There are certainly longer acting birth control options like IUDs or Nexplanon. Oftentimes people will choose to have those placed prior to travel so that they don't have to think about arrangements while they're gone. If you do take oral birth control pills, you should consider getting an extended supply of them prior to travel. Some people will get 3 months from their insurance and then purchase an additional amount to have on hand. That way you don't have to establish care in another country. Something else that is important to think about is sexually transmitted disease prevention. Having access to condoms when you're with you, condoms with you while you're traveling, if you're planning to be sexually active, is a really good idea. Finally, I just want to mention a couple words about consent. Consent in other countries can be different than in the US. In some cultures, accepting drinks or dinner can be seen as consent. And we really encourage you to obtain verbal mutual consent if you choose to be sexually active. Absence of that consent does not imply consent. Also remember that past consent does not imply consent in the future. Beware that your consent should not be gained by force, intimidation, coercion, or by taking advantage of someone. There is Title IX protected behavior. So sexual misconduct includes dating violence, domestic violence, sexual contact, non-sexual contact, sexual exploitation, sexual harassment, and stalking. If this is something that you experience while you're traveling, reach out to the university or program in the country where you're studying. You may also reach out to your study abroad advisor or the Dean of Students office here at UW-Stout, and they will assist you. The Bridge to Hope, which is a domestic violence shelter here in Menominee, also can provide resources for Stout students who are traveling and when they return. We wish you Safe and healthy travels during your study abroad experience.